Perceive, process, perform. Do you need inspiration for your practice, or do you simply need to practice inspiration? With this series, we aim to do both. Give us 15 minutes and we'll give you practice inspiration.
I'm Kirk Behrendt. This is my practice inspiration for the day. And as your practice grows, you know, we've all got to get better and we all have to learn how to train patients. One of the things that we're going to train patients on is better financial arrangements. As your fees go up, you need higher competency skills and tools to be able to communicate with patients on a much higher level. And so I'm going to share with you 9 best practices that we see consistently in higher level restorative or specialty practices. And number 1 is always this, and I've learned this over and over again in over 20 years, you have to have a confident person presenting fees, because there are people that can do this and there are people that can't. And you can't be in a business of trying to rehabilitate somebody else's weaknesses, because the fastest way to go broke in any business, specifically a dental practice, is to hire somebody who has a low self-esteem and is afraid of money. Now that's not a judgment, it's just an observation. There are people that are very strong and confident and they believe that what you do is valuable. Now here's my question for the day. Do you agree with this statement? Money spent in your office is some of the best money people could ever invest. My hope is that you said yes. And your team has to believe that, because if they don't believe that, they will start to unsell dentistry. 70% of all case acceptance failures happen between the clinical discussion and the financial arrangements. We see clinicians do an amazing job, and then you can see it. You go, oh no, oh no, oh no. And then it gets into that room or gets to the next point, and you can see the team member hyperventilating, and a lot of their signals that come off to the patient aren't confident ones. So that's a transition that's got to be practiced, and you've got to have a confident person. I always love taking a look at the rest of the world, and vets are fascinating to me. We have a dog. I always tell the story. I didn't want a dog. My wife wanted a dog, so we compromised and we got a dog. But the dog, and I love the dog now, but the dog got sick and we had to take it to a vet. And I could see it was experiencing respiratory failure. I go to the vet, and the vet says, okay, your dog has some type of a virus. I'm pretty sure I can save the dog. And then he gave me the fee. We're gonna have to keep the dog overnight. I'm gonna incubate the dog, blah, 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 blah. And here's the fee. And I said, okay, great. He said, okay, well, I need 75% of the fee now to take the dog. And I said, great, gave him a card. And once he got the dog started, he came back and I said, hey, can I ask you a question? He said, what? I said, what happens when people don't pay? He said, what are you saying? I go, what happens when people don't pay you? He's like, I don't know what you're saying. I said, well, I work in dentistry and people don't pay. And he said, that's crazy. If people don't pay, we don't take the dog. And it's amazing, in the rest of the world, people are taught to pay. You go to Costco and they don't say, do you want to pay a little bit now, a little bit later? You just pay. And that's the key thing, is you've got to teach people how to pay in your business. Number 2 is this. People that owe you money, they don't like you. They don't like you. They're avoiding you. As much as you want to believe there are friends or patients that you trust, if they owe you money, they don't like you in some fashion. And that's been said for years and years and years. But the truth is, you never want to get yourself into a position on a trust basis relationship, especially with patients, in which they owe you money. Because if they owe you money, they're going to avoid you and they're not going to enjoy coming to the appointments. Number 3 is this. Watching data over and over again, we have found there are no reasons to extend any type of payment beyond 90 days. Now, with all the tools you have like Care Credit and everything within your office, I'm not a fan of extending payments at all, but if you're going to extend it, don't go beyond 90 days. As a matter of fact, I don't even like going beyond 60 days, because you can already look at your AR accounts and you can see anything that gets outside of that window is very, very dangerous. So keep that in mind when it comes to discussing financial arrangements and best practices within your practice. Number 4 is this. Before I tell you the tip, I want you to understand the concept and why. In financial arrangements, in great restorative dentistry or specialty dentistry, we teach people, don't be good at answers. Be really good at questions, because you're going to get difficult questions. And one of the ways you can create intimacy or better understanding is asking a better question. So when patients do this, and they do it every day in your office, they'll come in and they'll go, gosh, this is a lot of money. Can I make payments? Don't say there's 9 ways to pay. You can do a third and a third and a third, or you can do 13% down, a half and a half. And don't do that. When somebody says, can I make payments? It's important to have a team member that can think on their feet and say, ooh, that's a good question. Here's the question I want you to ask when you get the question. Mrs. Jones, share with me what you're thinking. And they're going to provide a solution. I'm not going to tell you it's going to be the perfect solution, but oftentimes you're going to see this. In a $10,000 case or a $20,000 case, patients will say, that's a lot of money. Can I make payments? And if you say, Mrs. Jones, share with me a little bit about why you asked that question and tell me what you're thinking, the patient might say in some cases, gosh, is there any way I could do $5,000 today and then maybe $1,000 a week? And you can go, mm-hmm. So, and the cool thing to understand about this is to pause enough to understand it's the patient's solution. Once the patient comes up with a solution, it's a much more powerful treatment plan or financial arrangement plan than yours. Number 5 is this. The key in dentistry now, and I hope you're not doing, if you're watching this, please, I hope you're not doing this. Your payment arrangements and your appointments, those are two completely separate bonds of trust that you have with the people you serve. Your payments and appointments should be completely unlinked. Please don't do this. Unlink them today. If you have your payments linked with the appointments, unlink them immediately, which means this: patients have their appointments and their payments are completely separate from those appointments. Because you know how this goes. If I run out of money, what am I going to do? I'm not going to make the appointment. So Mrs. Jones, here are your appointments. And if you're going to extend payment, or like I said, not beyond 90 days, here's how this is going to happen. This is going to be a debit every Friday. This will be the amount. Or in the first of the month, we will debit this particular amount. It will change your life. Number 6 is this: patients with balances. Be very aware that people that owe you money, they are not good for your schedule. They've already showed you they're behind. And I shared this in one of the other thought processes we had earlier today is you have to tell people, Mrs. Jones, let me share with you how patients pay for dentistry here. So people that have balances, keep in mind this: when you put a person in the schedule that owes you money, you can pretty much take it to the bank that you won't be taking it to the bank. And it's important to get them caught up. Remember, we teach people how to treat us. So when people have balances, identify that in the morning huddle and then say, I love this. I learned this from some of my practices in North Carolina. They say the most amazing phrase. Here it is. They go, Mrs. Jones, I notice you have a balance. Let's get you all caught up. I love that. Let's get you all caught up, which implies you're behind. And number 2, before we go any further, we're going to get you all caught up. So make sure that people with balances don't have further appointments in your schedule. Number 7, this is a big one. This has been taught forever. When you present a fee, please give the patient the fee and then don't talk. Just pause and let them process. This freaks people out. Dentists, especially, dentists hate spaces. They hate spaces in conversation between when they present a fee and when they hate spaces in teeth, they hate spaces in schedules. Be comfortable with space, especially team members with this. When you present a fee, don't talk. Let the patient process. And the first thing that they say, it's very important to listen to exactly what they're saying and why they're saying it. And now you become the advocate for them. Number 8, I love this. This is for, if you're looking to get started, we teach dental students this. We teach people that are in scratch starts. Sometimes just give people the fee and give them bug eyes. I love that. Mrs. Jones, your fee for today is $1,100. That's it. And patients will go say, I guess I have to pay the $1,100, and you can go, mm-hmm. Oftentimes people just fill the space with words, present the fee, and give them bug eyes. Same thing with appointments. When people come up, don't say, what works for you? I can see you on Thursdays, Monday. Say, Mrs. Jones, I have next Tuesday at 8 o'clock. That's it. And you'll see how remarkable and easy it is on your life. And lastly is this. One of the things to consider when it comes to improving financial arrangements with the patients is that all breakdown is really going to show up in one of 3 places. It's going to be in the procedure, it's going to be in the financial or investment side, or the time aspect of that. And so we require all practices, encourage all practices, do a pit stop for every patient. I've got a dentist out east and he's got a little rubber stamp and he puts them on his routing for his P.I.T. just to make sure that it's the checklist we've covered with each patient. Mrs. Jones, Here's the procedure we discussed today. Here's the investment around the procedure, and you can expect to be here for 3 hours. And then they take the patient up to the front, and the pit stop has already been performed for the person up front. The key here is this. We want to set the person up front for success. I don't want that person selling dentistry, discussing all the details. It's got to be nothing but net by the time it gets up there. And all too often we just leave it to them and say, good luck with that one, and run away. So those are my thoughts for the day. Don't try to use all of them right away. Use one a week, put it in your practice and see how it makes incremental progress, because that's the thing we need. As human beings, as dentists and as team members, we need one thing. It's called progress. I wish you big progress. My name is Kirk Behrendt. Have a great year.